Dear ANA community, how to identify the exact Nidana in an individual? There are several classifications of Nidana are being explained in Ayurveda textbooks. How to decode those classifications of Nidana in an individual whenever if you come across with the patient in the hospital or in your private clinic. That is the topic of discussion today. Dear community members, press the like button and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. When you think about the Nidana aspect, that is what is considered to be the etiological factor or causative factor in the manifestation of the disease. Several classifications are being told in the textbooks. That is, the too in the Madhava Nidana, Madhakosha commentary, several classifications are being mentioned. Among them, Sannikrishta, Viprakrishta, Vibhichari and Pradhanika is one set of classification. Asatmendriyartha Sanyuga, Prajnaparadha, Parinama, another set of classification. Dosha Hetu, Vyadhi Hetu, Ubhaya Hetu, third set of classification. Utpadaka Hetu and Vyanjaka Hetu, Bahya Hetu and Abhyantara Hetu. And among the classification of the Abhyantara Hetu itself, Urdhva, Adha and Tiryagati, depending upon the movement of the dosha as such, Kshaya, Sthana and Vriddhi, depending upon the quantification of the dosha in the body, Achaya, Prakopa and Prashamana, depending upon the seasonal influence of the dosha, Shakha, Koshtha and Marmasti Sandhi, depending upon the location of the vitiated dosha in the body, and Sama and Nirama stage. So these are the several classifications are being explained in the textbooks. So here we are going to discuss with taking one particular example. Here a male individual of a certain middle age is actually doing the cycling in the winter, in the early morning or in the winter, wherein the cold air that will be exposed to the different parts of the body, no sunlight at all, etc. So we are going to observe in this particular situation how to decode the Nidana. When you think about the first set of classification, that is Sannikrishna, Viprakrishna, Vicharya and Pradhanika, in that particular situation, Sannikrishna Nidana, we are going to say there may be the possibility of a Vata dosha vitiation because whole body is being exposed to the Shita Vata itself, cold air as such. Hence, we are going to say there may be a possibility of Vata dosha vitiation. So here Kapha dosha vitiation may not be evident because the nature of the cold air that is actually Ruksha. And as far as Viprakrishna Nidana is concerned, Shita Vata Sevana. Whereas Sannikrishna Nidana is Vata dosha vitiation, Viprakrishna Nidana is Shita Vata Sevana. And when you think about the assessment of Vichari Hetu as such, so as such the main Nidana is Shitavata Sevana and Dushya may be the affliction of Mamsa as such, that too in the lower limb, as the person may have the muscle cramps or joint pain as such. In that particular situation, Vata Dosha Vitiation. So here the Vata and Shita, they are actually somewhat related, but Mamsa that may not be related because the Ashraya Shray Bhava, the main dosha that will be having the affinity towards Mamsa Dhatu is Kapha dosha. Hence, so here the degree of the dosha vitiation or degree of the disease manifestation is comparatively moderate because the Nidana and dosha, they are comparatively having the similar nature, but dosha that may not be having that particular similar nature. And as far as the pradhanika hetu understanding is concerned, if the person is doing the activities continuously, then we are going to say the person is having the pradhanika hetu as shita vata sevana. In this way, we can able to decode the sannikrishta, viprakrishta, vichari and pradhanika. When you come to the second set of classification, taking the same example, so asatmi indriyartha sanyoga, that we have to decide depending upon the nature of exposure of indriya, both jnanendriya as well as karmendriya affliction that may be observed here. Let us take the two examples here. If the person is not covering the eyes, so because of these glasses, etc., or spectacles, then there may be the possibility of asat mindiryartha sanyoga. In that particular sense, the cold air that will be entering into the eyes, resulting in the irritating sensation or the redness of the eyes, etc., etc. If the person is not covering the ears, then the shita vata that will be entering into the ears, producing the pain in the ears or headache, etc., etc. In this way, asatmya indriyartha sanyoga can be understood. Whereas the pratnya paradha, when you think about it, the person is doing the cycling without covering his the some of the various parts as such. Though he has covered the most of the body parts, but face is not covered. So that means there may be a possibility of exposure of eyes, exposure of mouth, exposure of nose, and here if it is not being covered ears, then those are the indriyas, they are going to get exposed to the shita vata. Whereas the third aspect, that is the parinama, we are going to say that is there may be a possibility of the kapha dosha accumulation. Of course, vata dosha vitiation is being present all over the body, whereas kapha dosha accumulation there may be possible in the uraha pradesha or in the pranavaha srotas as such. In this way, the decoding this type of the nidana in this particular asatmindriya sanyoga pradnya parada and parinama. The third set of the classification, so dosha hetu. As such, here shitala vihara, that is leading to vata dosha vitiation. But textual example says shadrasopeta ahara. But based on that particular part, this particular shadrasa ahara, that cannot be given example for dosha hetu here. So here dosha hetu could be shitala vihara, leading to vata dosha vitiation. Whereas vyadhi hetu, that is little bit difficult to predict, because the bahya srotas, when you think about, there may be the possibility of the exposure to the eyes, exposure of nose, exposure of the ears to the shita vata can be observed. When you think about the abhyantara srotas, pranavaha srotas affliction may be observed, rasavaha srotas, that too over the face, that may be observed, raktavaha srotas, that may be observed, mamsavaha srotas, particularly in the lower limb, we are going to predict their affliction, and astivaha srotas, maybe towards the knee joint, etc., we are going to observe. Mutravaha srotas, because of the person may have excess micturition that may be possible, and svedavaha srotas, because of peripheral vasoconstriction, the person will not be having the production of the sweat as such. In that way, the vyadhi hetu, the assessment may be difficult in this particular example. Whereas ubhaya hetu is concerned, so that is depending upon the patient's presenting complaint, we have to decide. So here shita vata leading to the vata dosha vitiation, plus there may be the possibility of mamsa or asti affliction, we may suspect, when you are thinking about from the angle of ubhaya hetu. Utpadaka hetu and vyanjaka hetu. Suppose if the person is doing this particular cycling for the first time, then we are going to say they apply the concept of utpadaka hetu. Whereas if the person is doing the same kind of the activity continuously, regularly in the winter for 15 days, etc., then we are going to observe or apply the concept of Vyanjaka Hetu. When you think about the Abhyantara Hetu and Bahya Hetu, so here we are going to say the two different examples, that is the Nidana, Shita Vata Sevana and Vyayama. These are the two Bahya Hetu that can be considered in this particular example. Whereas when you consider the Abhyantara Hetu, that will be considered to be depending upon the nature of a clinical presentation. For example, if the person is presented with the pain in the knee joint, then we are going to say there may be a possibility of Vata dosha vitiation and asthi affliction. Suppose if the person is presented with the pain in the calf muscles, in that particular situation, we are going to say there may be a possibility of the Vata dosha vitiation and Mamsa Kshaya as such. Whereas if the person is presented with sneezing, then we may suspect there may be a possibility of the Vata dosha vitiation, but the Dhatu affliction may be difficult to predict because the sneezing will be considered to be instantaneous. Within a day, the person will be having the presenting complaint. But if this particular presenting complaint persisting for more than 7 days, then we are going to say there may be a possibility of a dhatu affliction also. Then regarding the next set of the Abhyantara Hetu, that is Urdhva, Adha and Tiryagati. So here Urdhva and Adhavgati, that will be considered in the Mahasrotas. Whereas Tiryagati, that will be considered other than Mahasrotas. Maybe in the intravascular compartment, or maybe in the interstitial compartment, or maybe in the intracellular compartment. When you think about the Urdhvagati, if the person is presented with tastelessness or loss of appetite or vomiting, then we are going to say the possibility of the the movement of the dosha is in the upward direction. Whereas Adhogati refers to the person will be presented with either bloating sensation or constipation or diarrhea. So those two Urdhva and Adhogati, they are mainly related with the Mahasrotas affliction. Whereas Tiryagati, as such, where the clinical presentation will be, for example, pain in the knee joint, or heaviness of the head, or dryness of the facial skin, etc., etc. In this particular example, where there will be the possibility of movement of the dosha that will be observed in the either in the intravascular compartment or in the interstitial compartment or in the intracellular compartment. In this way, the dosha gati from the angle of the direction of movement of the dosha that can be predicted here. For example, here the next set of the Abhyantara Hetu classification, that is Vriddhi, Sthana and Kshaya. When you think about the Vriddhi, where the person will be having the pain in the knee joints, associated muscle cramps, we may suspect there may be a possibility of a Vata Vriddhi. And what kind of the Kshaya that you may suspect there? There may be Kapha Kshaya may be observed, plus there may be Mamsa or Asthi Kshaya that may be observed in this particular example. Whereas Sthana, in the sense, there will be the Pitta that may be in the normally condition. Coming to the next set of the Abhyantara Hetu classification, Koshtha, Shakha and Marmasthi Sandhi. Suppose if the person is presented with the symptoms related to alimentary canal, maybe related to the mouth or esophagus, stomach or small intestine or large intestine, then we may suspect there may be a possibility of a Koshtha affliction. Whereas if the person is presented with the symptoms related to skin, symptoms related to blood, symptoms related to muscles, then we may suspect Shakha affliction. If the person is presented with pain in the knee joint or headache, etc., then we may suspect Marmasthi Sandhi affliction. The next set of the Abhyantara Hetu classification, that is Chaya, Prakopa and Prashama. So here Chaya of Kapha dosha that may be observed, whereas the Prakopa of Vata dosha that may be observed because the environment, that too cold environment, that will be having the Shita and Ruksha Guna. Whereas Prashamana, so here difficult to predict in this particular extreme environment as such. As far as Sama concerned, Samavata that may be observed, this can be attributable to poor intestinal motility or poor digestive secretions or worsening of the condition at that too during the cold environment that may be observed. Whereas Sama Kapha that can be predicted because during this particular season, if the person is having the sputum production, he will be having the inability to expectorate that particular sputum to the exterior due to cold environment. In this way, we are going to decode the Nidana whenever if a person is coming to you with the presenting complaints as such. That's all for today. Dear community members, what are the major key takeaways from today's discussion mentioned in the comment box below? What is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. That's all for today. Something more in the next video. Thank you.